Hi, I'm Bobby Peterson. We're going to be talking today about WisCare 2019. It's a proposal developed by ABC for Health that will hopefully dramatically reduce healthcare costs, expand healthcare coverage in Wisconsin. We know that the current healthcare and coverage landscape is very challenging for people. We have increased premiums, ballooning uncompensated care. There's the segmentation of the market between the healthy and the sick, political battles between progressive, conservative, middle of the road, no one can agree, politics of fear and greed that drive the process, and we have depleting consumer confidence. So we do need to make some reforms. We need to make some progress in how to create a system that impacts everybody favorably and reduces costs. So what are the 5 major features that we're going to talk about? One is promoting pooling and spreading the risk. We know that healthcare coverage is fragmented. There's a lot of risk puddles. Pooling is a better idea. We include some sick, but a lot of healthy people, but overall it reduces cost. We use WisCare Plus as the foundation for WisCare. WisCare Plus is a strong program designed for children and families. It's going to be a good program to use as the base. We don't touch Medicare. We leave Medicare alone. Long-term care programs and waivers are left alone. This is really designing a coverage system for most other people. We use Medicaid funds from the federal government. We know we've passed up on up to $1.1 billion over the past years, and through this fiscal year, too much money has been left on the table. We could be using those funds in Wisconsin to reform our systems with money left over for roads and K-12 education. So it was foolish, politically foolish, not to take those funds. We say let's take them and let's use other waivers to expand coverage and be more efficient. We promote public-private partnerships. We're not saying the government should take over healthcare coverage. We think there's a way of integrating government oversight, private sector innovation, to do things in a way that's going to help secure coverage for the most people. And part of this process is to make sure that we assure accountability to build consumer confidence. People need to know that they're going to get the care and coverage they need and deserve for themselves and their family members. You have to build in accountability. You have to build in a sense of what your appeal rights are and how can you get what you need and how can you get the information that you need as a part of the process. So hopefully at the end of the day, we're going to reduce the cost of healthcare and coverage, promote consumer choice and confidence, and improve health outcomes. So that's the name of the game here, is that at a certain point, we want to make sure that people in Wisconsin are healthier, and we promote equity and reduce health disparities. What about pre-existing conditions? Well, the good news is that we would not include any pre-existing condition limitations for people that are a part of the WisCare Plus population already. That's most likely a requirement of a federal waiver or expansion, and we would mimic the open enrollment period for others, similar to the Affordable Care Act. So pre-existing conditions should not be an issue for WisCare. It's an important element. People need to get the coverage when they need it. You'd be able to get in during the open enrollment period. State and county employees, we would try to set it up similar to what exists now, that new employees would be able to join the pool without a pre-existing condition limitation. It's a very big improvement over a lot of the situations that are out there right now. I think that WisCare is going to be a major improvement for people who have concerns about pre-existing conditions. We would not set up segregated healthcare, high-risk pools. Lifetime limits wouldn't be a part of this plan. Higher costs for people with medical conditions. That's not the way we're going to roll. This is about making sure that we promote equity and reduce health disparities for all people in Wisconsin. This concludes our snapshot of the WisCare proposal. In the HealthWatch member exclusive library, we break down each component of WisCare in comprehensive detail. To gain access, click the link on the screen to become a member of HealthWatch Wisconsin. Thanks for watching.